Panic disorder. This is a fun one. This is not a fun one. Let me rephrase that. This is an interesting one. Okay. I don't know if you've ever had a panic attack. I have. They're not fun. Um, this is something that happens with a relative amount of frequency. Um, Something like a third to somewhere between a third and 40% of Americans report having had at least one panic attack during their lives. They're the worst, right? For me, the few times I've had them, it's been like late at night, I'm trying to fall asleep, and suddenly my body is just flooded with anxiety, and I get all amped up, and I start thinking about how everything's wrong, and my life is totally going off the rails, and nothing will ever be right again, and it's the worst. Um, Panic attacks and panic disorder are not the same thing, but they are related to each other, right? So you can see here the symptoms of panic attacks, where you may experience heart palpitations or tingling in your hands and feet, shortness of breath, sweating, cold flashes, hot flashes, trembling, chest pains, choking sensations, faintness, dizziness, feelings of unreality. Awesome. Um, that's a panic attack. Panic disorder exists when a person has repeated panic attacks to the point where they begin to change their behavior in order to avoid having panic attacks, right? And ironically, somebody with panic disorder can become so worried, so anxious about having a panic attack that they give themselves a panic attack. Awesome. Now, panic attacks do have different levels of severity. Like I described mine, they were unpleasant. I ended up taking a couple of 2 a.m. walks out in my neighborhood. That's fairly mild, though. I know my mother-in-law has reported having a few panic attacks where she actually checked herself into the hospital because she thought she was having a heart attack. They can be very severe events, and you can certainly understand why people would want to avoid them. That you start having those regularly, and you're going to do everything in your power to try to not have those. And when that gets coupled with high levels of anxiety, then that can lead to what we call panic disorder. You've got about 3% of the U.S. population that experiences this disorder in any given year, 5% across the course of the lifespan. This is something that usually starts to come about or emerges in late adolescence or early adulthood. And majority white Americans are more likely to experience this disorder than minority ethnic groups. You've got, in comparison to other disorders, you actually get a pretty high rate of folks seeking treatment, nearly 60%. And sometimes this is comorbid with agoraphobia. Now, comorbid is just a term, if you haven't heard that before, that just means going along with. Comorbidity means you've got two disorders occurring at the same time. So frequently you will find, or in some cases you will find panic disorder is comorbid with agoraphobia, which is the fear of open spaces. And the connection there seems to be, I don't want to go out, I don't want to be in a place where I am not safe, where I won't be able to get the help that I need, right? Right, with panic disorder, we're talking about excessive levels of anxiety and fear around the idea of having a panic attack. So people start to stay home, shut themselves in for fear of getting in a situation where they're going to be out of control, and they start having a panic attack in public. Start managing their relationships to avoid stressful conversations or unpleasant feelings. And as with most of our disorders, it becomes something that needs a diagnosis that becomes disorder level when it starts to reach the level of disorder dysfunction, or I'm sorry, distress and dysfunction. Where if it's interfering with a person's life and they can't do what they need to do because of it, then we're dealing with something that needs to be diagnosed, right? Now, what's going on? What causes panic disorder? Well, the panic attacks themselves seem to be caused by high levels of norepinephrine in the locus ceruleus. That was one of the original ideas. It does seem to be more complex than that as we have moved along and tried to sort of map what's happening in panic attacks with an fMRI machine. And it appears to be that there are overactive circuits, panic circuits, that connect the cortex of the brain with the amygdala, which is our fear center. And again, from a biological perspective, why do these appear to be overactive? Well, it appears that some people have genetic predispositions to the overactivity in these circuits, and that can lead to, this sort of running in families. Some folks just being more anxious, more concerned about these things, right? Now, how do we treat that? Antidepressants usually help with reducing the level of distress and anxiety. Some of our antidepressants specifically focus on or target the function of norepinephrine, and so you can see why that might be useful. If that's the neurotransmitter that is involved in these overactive circuits, if you regulate the function of that neurotransmitter, that's going to help downregulate the occurrence of those panic attacks. And then there are some anti-anxiety drugs like Xanax that are quite helpful as well. Now, looking at it from another perspective, from sort of the CBT perspective, it's undeniable that there's something physical going on, and so that does still need to be a part of what gets recognized. But unsurprisingly, the CBT perspective is interested in assessing and modifying how people are thinking about this event and therefore modulating their response to it. So from this point of view, these strong bodily sensations, these the high levels of panic, get misinterpreted as an actual something is really wrong that I have to respond to, like there's a tiger chasing me or something. This sort of evolutionary response, I need to take care of this. That then leads to these avoidance behaviors that then cause people problems. It's what we call anxiety sensitivity. Some people really do seem to have stronger physical responses than others. How do we know this? Well, there are things that we call biological challenge tests, where you actually bring somebody into the lab and either through high levels of exercise or through other methods induce a panic attack. So this thing that you hate, let's bring you in and have it happen. But then they are able to quantify sort of the level of distress, the level of physical response that a person has. This is useful not only in identifying this anxiety sensitivity, these people who have very strong panic responses, but then also allows the therapist in a controlled manner to be able to give the person more accurate information. Look, yes, your body is responding more strongly to these stimuli than the average person does. But it's just a body thing, and so let's teach you to think about it in more productive ways so that when this happens, you don't have to freak out and shut down your whole life, but rather you can recognize that this is simply an error in your body function and in your brain function. And then we'll give you some skills for coping with anxiety so that when that starts to happen, you can use your deep breathing techniques and your thought trains that we train you to think in order to talk yourself through these difficult panic episodes. That does appear to be very effective, and in fact, frequently with panic disorder, you'll get people taking both a medication to reduce the likelihood of a panic attack, and then also getting some level of CBT therapy, cognitive behavioral therapy, in order to think about it a little bit differently so that those events are not so stressful when they occur.